Well, last week we reported that the WHO pandemic treaty was dead on arrival after numerous countries refused to sign on to the treaty. However, I was contacted by Dr. David Bell, who's been on this show before. He is a public health physician who formerly worked for the WHO. He says it is far from dead and the threat is very, very real. Dr. David Bell, welcome back to the show. Thank you so much for being here.
Thanks for having me, Kim.
Unfortunately, we have to have you back with bad news. So tell us, we thought really good news that the pandemic treaty, a lot of people have been talking about this, fighting against it. They could not come to an agreement. They couldn't vote it in I think it was last week, maybe the week before.
Yeah.
Why are you saying it is still a very real threat?
Yeah, so there's the two documents, the pandemic treaty or agreement and the amendments in international health regulations. So yeah, they've been discussing these for a couple of years. They were discussing both into the week before the World Health Assembly meeting in Geneva. They didn't come to an agreement on enough of the pandemic agreement or treaty to get it to have a vote on it. So what they've done is send it back for further discussion, and they'll have a vote within the next 12 months when the treaty is finished. And they will change to some extent the negotiating group, the intergovernmental negotiating body that was discussing it, which I think will probably be in favor of getting an agreement more quickly.
Okay. So what they've decided to do is go back to the drawing board. They've got 12 months. And in 12 months...
Not back to the drawing board, but there's about a third of the articles in the agreement that they haven't agreed on. Some of them, there's small agreements, some of them there's major. Yeah, so they're going to go through those and find a way to agree.
What were the biggest sticking points?
It's difficult to say. The agreement has changed a lot over the last 2 years or 18 months. There's disagreements on things like One Health and what that actually entails. A lot of this is about surveillance, and they're talking about surveilling everything from animals, veterinary, humans, the environment, etc. And this is it's just ridiculously expensive, resource intensive to do this for most countries. So a lot of the pushback has come from particularly African countries that see this as irrelevant to their health burdens, which it is, but going to be enormously expensive. But a lot of the surveillance has gone through in the international health regulations. So the basis of what passed there was the surveillance package. So,
and what is surveillance? What does that entail?
Yeah, so on the surface, it seems good. You're setting up a lot more laboratory capacity, a lot more people to look for variants of viruses that could conceivably pose a threat. And
they're testing things like sewage. They're testing when people come in and they're sick and they have to report, test things like that.
Doing things, like PCR and genetic sequencing and so on that we couldn't do 40, 50 years ago, couldn't do some 20 years ago in a lot of countries. So we will find lots and lots of viral variants. The bird flu story in Mexico actually is an example of this. And the fact that we found bird flu virus in milk in the US, it's probably always been there intermittently. Bird flu is as old as birds. But we now have the tools to find these. So we haven't had a severe outbreak from a natural event since the Spanish flu over a century ago. But, given that COVID is almost certainly gain-of-function spillover from a lab, so we are looking for something which is extremely rare in terms of a severe disease, but viral variants are really common. And you could make out that any viral variant is a potential spillover, even though it happens, on a significant extent less than once a century. So we are setting up a system where, and the IHR amendments do this, and the pandemic agreement, when it's passed, will strengthen it further, to have this huge surveillance network find potential threats. On the basis of a threat, the IHR comes into force. There's recommendations to lock down, close borders, etc. There's a 100-day vaccine program, mRNA vaccines being developed at CEPI, which is a public-private partnership set up just for this, even before COVID.
Because
And
mRNA's worked so well.
it
That's why.
works so well, it's so safe, and so it's a
Right.
great past history. And so then we will get our freedom back through an mRNA mass vaccination, and it generates, every time you do this, potentially hundreds of billions of dollars for the people who are pushing this whole agenda.
Right.
Sorry, hundreds of billions.
Hundreds of billions of dollars. And that's when you were on the show last time, we talked about this, how the WHO is really just a mechanism for these super rich
it's a
corporations.
tool. Yeah.
It's a tool for them to push their agenda. It's like a government, they basically have a corporate capture of the WHO. And if they can get some sort of power over people, power over countries to behave in a certain way that's going to benefit them and make them more money, that is what they're essentially doing. And that is a huge threat, because we saw with Big Pharma during COVID, they made billions of dollars on vaccines that didn't really, I mean, now we're seeing more evidence of the vaccines. There was just a recent study that came out that we reported on here. There was a few Dutch scientists, researchers, who found that there were more deaths after the vaccines were rolled out than before the vaccines were rolled out. So
we've known this
what
for
was the benefit
2 or
of
3
this?
years. This is we see the excess deaths all the time, and yes, they're higher than they were during the first year. They've continued to rise. Some of that will be due to the effects of lockdowns as well. If you stop chemotherapy, you stop screening for cancer, more people die of cancer. But there are multiple theoretical mechanisms.
So the main pushback on this pandemic treaty, you would say, is the cost of the surveillance. That it does sound like that's extremely expensive. If we're having to test everything from
it's
milk,
not the cost, Kim. It's the cost is one thing. We're talking about up $30 billion a year, compared to, which is almost 10 times what the whole total WHO budget is. But the problem is what that does. So we will constantly, we see in Mexico now that the whole world's press is going on about the first death from this strain of bird flu. It's unfortunate. It's in a person who was already bedbound for weeks, has chronic renal failure, has diabetes, etc. So it's someone who is very likely to die from a mild virus. But it's in the whole world's press. And we're finding it in milk. It's in the whole world's press. And there is a very strong push already. We have quite mad people out there calling themselves virologists, saying we could see 25% mortality. We have never seen that. It's probably never happened in the whole of hundreds of thousands of years of human history, of humanity. And we've never seen it in human history from an influenza virus. So the problem with this whole system is, apart from being extremely expensive, it creates a constant situation where you are finding viral variants, and you have a whole thousands and thousands of people whose sole job is to act on that.
Right.
So
well, no, I understand.
Yeah.
I understand the frightening, the terror of the surveillance system and what that does to us. Because if they're constantly looking for something and then they say, "Look what we found," and everybody needs to be afraid. Everybody needs to start running for their lives. It's 25% death rate, like you were saying with the bird flu, which is ridiculous. I understand that the danger of what they're trying to set up is clearly just trying to get us into pandemic after pandemic after pandemic. That's just going to make these rich people, these corporations, billions of dollars, who are heavily, they're the ones using the WHO as this tool to do that. But I'm saying that the hang up, I think what my concern is why these countries didn't sign off on the treaty. I would love it if they didn't sign off on the treaty because they said, we don't like that scenario. But it sounds to me like they didn't sign off on it for other reasons. It was African countries saying surveillance costs a lot of money. We don't really have the money for that. We don't want to do that. It's not about, and this has kind of been one of my problems with a lot of the court cases that have been won even against the government with the mandates and whatnot, is that they're not won on the merit of it's just unconstitutional to do this to people. They're winning on these little kind of technicalities. And if these countries are not signing off on this pandemic treaty because of little things like that don't have to do with the entire premise of the problem that you and I can, are afraid of, then that is a real fear that they're going to pass this in 12 months when they
Yes.
work out all those little kinks.
Yeah, so there's a mix of reasons. One of them is that people in the negotiating process see that this is wrong. And quite a lot of
Okay,
people within the
there
country
are some of those
delegations, you see
people.
there's sensible people
Okay,
involved in this. There's sensible people in WHO who are seeing this as wrong as well.
good.
The problem is that the political masters go to Davos every year and are dependent on pharmaceutical companies to a large extent for their to be re-elected, and the media is highly dependent on the pharmaceutical companies and the financial institutions for its sole survival. So we have a situation where even if a reasonable number, certainly not all, of the public health people involved can see that this is insane, their jobs depend on pushing it through. Their future careers are all bound up in either pandemics or health and climate change. And so that's where the jobs are. And the people in charge of this can always switch people around and ensure that there's more political influence and less rational public health influence in the process. So I think that's what will probably happen with the revamping of the negotiating board for the agreement. And we will see the remaining disagreed issues largely resolved in the next 6 months or so.
So you do think that this is going to get through? Is
Yeah,
basically
it'll
what you're
get
saying.
through. Even if it doesn't get through, it won't change a lot. We managed with COVID to concentrate a couple of $1 trillion from the average person in the world to a very small few that were running the whole
Yeah.
thing. We did that without these being passed. And so it's a successful model, even if you don't have this. This all helps, but you can do it working direct with governments, not through the WHO. The WHO will toe the line anyway. And the media is on board, etc., which means politicians will be on board. So what they're putting through WHO helps this process, but it's not necessary for this to work.
Right. Okay. So it's kind of the focus. The focus is almost on the wrong thing a little bit then, because we got to get to the root of the problem
It is.
rather
We've got to
than
get to
this
the
is
root of
just
the
another
problem.
symptom.
Yeah, and
Yeah.
I think
And what
in
would
the
you
end,
say
the
that
root.
root is?
Yeah, in the end, it is a few financial institutions and those that control those institutions having significant ownership or controlling interest in most of our corporations, public corporations, including pharma, including media, etc., and using those assets to maximize return on investment for themselves and their investors. And we have a huge monopoly in terms of ownership of public companies, a near monopoly. We have certainly a monopoly of influence, and we have a huge conflicts of interest within our supposed intergovernmental bodies, such as the WHO, such as the UN, where we've allowed direct funding from these interests, and that funding allows very much control of these organizations. So it's an issue of conflict of interest, but in the end, it's an issue of a very small percentage of the world having control over our corporations and therefore over our governments and much of society. And clearly, this is getting worse. Financial inequality is getting worse. That's what allows this to happen. The more money you have, the more people you can buy, and the more institutions you can buy, and that's what we're seeing. So,
Yeah, so we've got these private organizations that are funding the WHO, using it as a tool. So you've got like the Bill and Melinda Gates Foundation. They're the second largest funders of the WHO, I believe. We know that Bill Gates has this real vaccine crusade. He's on a real mission to vaccinate the world. And then there's of course pharmaceutical companies that have a huge interest in this, especially after they saw the big boon from COVID. They just got a windfall of cash and they would like to keep that going. So they have these interests, and you're saying that they then infiltrate the media. They pay for a lot of advertising. These media companies then rely on that money as well. So they want to say
absolutely.
the things to make their sponsors happy.
Watch CNN, and it'll be brought to you by Pfizer. Uh,
Right, exactly.
it's not hidden. The New York Times and so on, they're very, very heavily. They're not only majority owned by BlackRock and Vanguard, or at least they're the largest shareholders.
Yeah,
But they are also directly dependent on the pharmaceutical companies that also own, share the largest shareholders. They're dependent on those pharmaceutical companies very heavily now for survival. So that they
yeah,
are not going to do any incisive reporting of what's driving this, and even doesn't make sense to divert, $30 billion to pandemics when tuberculosis or heart disease kills 30, 40, 50 times more people, and it gets 1/10 of the funding. It's something they're not going to go into because you can't make a lot of those money out of those other diseases. You can increasingly out of things like diabetes, which I think is why, there's another story there, but why there is not more emphasis on improving diet, on reducing chronic disease, which makes you more
right.
likely to die of pandemics, but it's not mentioned anywhere within these agreements. And makes you die early from all sorts of other causes, from cancer to heart disease, etc. But all these diseases are huge money spinners to the pharmaceutical industry. It comes back to this essential capture of the whole health sector, which is now primarily for profit rather than for population health.
Well, yeah, we do need to get to the root of that problem somehow and start focusing more on it, on getting back to real health rather than
Mm.
the push by the pharmaceutical companies to just make billions upon billions of dollars on us. So, really appreciate you reaching out and saying, hey, it's not actually really dead. They're gonna fix some things and come back, and they're gonna still push this on us.
Yeah.
It's unfortunate, and we'll definitely keep watching. And maybe there can be. I mean, is there anything you think we can do to get
No,
them
we
to
can.
not
I mean,
pass
the
this
fact that
treaty?
it is postponed because the people negotiating this, quite a lot of them are influenced. They're not stupid people, and they read as well, and they're aware that this doesn't make sense. The more that the public makes this really clear and politicians make this clear, the more it empowers these people as well to push back internally. It's
Okay,
very hard if clearly all the politicians are pushing for more pandemics, more money to this sector,
right.
and politicians will react to public pressure. So it's just
So we just got to keep the
we
pressure
just got to
on, is what
keep the
you're saying.
pressure on, and we've got to keep telling the truth about what's going on.
Yeah. Okay. Dr. David Bell, thank you so much. Formerly worked for the WHO. He is now a senior scholar at the Brownstone Institute. Thank you so much for your insight.
Thanks, Kim.
Thank you for watching this clip from the full Kim Iverson show, which you could catch just by heading to that link down below, KimIversonShow.com. You can watch the full show from what you just watched, or you could catch the full show live Monday through Friday, live streams, 5 p.m. Pacific, 8 p.m. Eastern at KimIversonShow.com. See you then. Be sure to like, share, and subscribe. Never miss an episode. Never miss a clip. Never miss a segment. Thanks, guys.